Hello, I'm Cathy Petersen, a volunteer with the Dayton Area Chamber of Commerce. You are watching Business Connection, a program produced by the Dayton Area Chamber of Commerce. The Chamber is committed to finding business solutions by collaborating with regional business leaders on key issues. Thank you so much for joining us. Our guest today is Lori Conine, Individual Small Group Manager with Anthem Blue Cross and Blue Shield. Thank you so much, Lori, for being here with us.
Thank you. Thank you for having me.
Tell you what, healthcare, a very hot topic, especially when it comes to businesses. Now, the Dayton Chamber's made a concerted effort to educate their member businesses on the many changes occurring in the healthcare arena over the past several years. Now, recently we've heard the term grandmothering quite frequently. Can you explain what that means?
Absolutely. So 2014 was a big year for the Affordable Care Act. Many changes in terms of the benefits that we need to offer in our plan designs. And grandmothering is actually a term that came in the beginning of this year as President Obama, the feds, decided to offer what's called Transitional Relief. And what that means is employers can keep the plan they have and individuals can keep the plan they have for another year. So as Anthem Blue Cross and Blue Shield reviewed the language in the guidance, we decided that we were able to offer grandmothered renewals to our small group clients beginning July 1st of this calendar year. And we will be able to offer grandmothered renewals to our individual clients beginning October 1st this calendar year.
So Lori, what new limits, rules, and taxes have affected health insurance rates in 2014?
2014 is a big year for the Affordable Care Act. This is when the bulk of the changes went through. So some of the significant changes include the out-of-pocket limits. They've increased, or actually in some cases decreased. The most that an individual would have for an out-of-pocket limit is $6,350. A family, $12,700. The plans are now guaranteed issue, meaning a person cannot be declined for coverage. Pre-existing condition limits, those no longer apply. We've enhanced our benefits, and all cost shares must now apply toward the out-of-pocket maximum for in-network services. And then there are taxes and insurer fees that go toward the premiums as well.
So yeah, so some actually pretty significant changes that affect so many people, but it sounds like, you know, they're good changes.
Very good changes, and again, in the small group and the individual market, now there's modified community rating. So we can no longer rate high for certain medical conditions or rate favorably for other medical conditions. And again, we can't decline someone for their medical conditions. So that's one of the biggest changes in 2014.
Right. Well, as a small business, the law doesn't mandate that they provide coverage to employees, correct?
Correct.
Now, however, offering these benefits may be important to a company's ability to retain and attract talent. And that's a big issue, especially in the Dayton region.
Right.
You know, we really want to attract and retain talent. So, you know, what are the choices?
For small group employers, we actually have many choices. We will offer, again, we talked about our grandmother plan. So if you're a current Anthem client and you renew with us between July and December of this year, you have the ability to take a grandmothered renewal, keep the plan you have for another year. We also offer plans that are ACA compliant. So those would be the plans with community rating, guaranteed issue, and then for September of this calendar year, we're actually rolling out a new product. It's called Anthem Balance Funding, and it is a self-insured product that will be available to employers that you'd have to cover at least 25 or more employees. And then in the larger small employer market, the 51 to 99 market, we also offer our private exchange. It's called Anthem Health Marketplace, and this gives an employer an opportunity to offer a defined contribution strategy, which is a little different than before with just a defined benefit strategy. So they may offer 4 or 6 plans, choose their contribution very specifically, and then allow the employee to choose their benefits within that 4 or 6 family of plans and buy up, if you will, if they want to increase the benefits that they have.
Definitely. It's good to have those choices.
A lot of choices.
Definitely. So how does an individual buy health insurance?
So an individual, and that would be you or I, we don't get our benefits through our employer. For 2015, open enrollment begins November 15th. It goes all the way through February 15th, 2015. So there's a few different ways you can buy insurance. You can buy directly from the carrier, and that could be go on the carrier's website, go to anthem.com, and you can buy from us directly. You can call our toll-free number. We do have a telesales division, or you could go to the federally facilitated marketplace. You could go to healthcare.gov, and for those folks that are interested in seeing if they are able to qualify for a subsidy, that might be the best place to go. And then brokers, you know, we still recommend a broker as a very good resource, someone who will help you through the process, show you all the plan designs that are available, explain to you what the benefits are, who the network is, who the doctor is, and then they'll also help you through the subsidy process. And if a person uses a broker, they don't pay anything additional for their benefits. So the same cost whether you buy direct on your own or if you use a broker.
It is nice to have that resource
Right.
out there because there are a lot of choices out there and you want to make sure you have the best one for you and your
Right.
family.
Correct.
Yes.
Yes.
So in February of this year, the employer mandate was delayed for those employers with 50 to 99 employees. Now, you touched on this a little bit, but what were the significant implications of that delay?
Well, of course, the most significant implication is there's no penalty for 2014. So, you know, that's an important piece because while there is an individual mandate, there is no employer mandate. So if an employer with 50 or more employees doesn't offer benefits today, in 2014, really nothing changes for them. If they do offer benefits, it's important for that employer to let the employee know if the benefit they offer includes minimum essential coverage. If it does not, then that employee may be eligible to go to the exchange and receive a premium subsidy. And you know, what's important to know, you know, a person may go to the exchange and receive a premium subsidy. It may or may not be as much as the employer contribution. So a person really needs to weigh the pros and cons of employer-sponsored benefits.
Right, and do your research, you know, and so you know what you're
Right.
getting.
Right.
What are the trends that you've seen over the last year in terms of employers dropping coverage?
For 2014, in my market segment, in the 1 to 50 segment, we've been tracking our renewals, and we really have not seen a prevalence in Ohio at this time for small employers dropping benefits. And then in our mid-market segment, the 51 to 99 segment, the key segment, we really haven't seen a trend there either. So I think, you know, that may evolve, but at this point, I do see employers continuing to offer employer-sponsored benefits.
Wonderful. Now, as a larger business, if a large business chooses not to provide coverage, what are the penalties they might face in 2015?
So the test is two-pronged. And I don't want to go into too many intricacies of the law, but depending on what the employer offers, if they offer a plan that has minimum essential coverage and if the plan is affordable, those are the pieces that are important to determine if they meet the guidelines and if they would be subject to a penalty. Now, you know, depending on which piece they may or may not do, the penalty could range from $2,000 per employee all the way to $3,000 per employee. So it's really important for employers to make sure they're complying with the law next year. Obviously, there were changes with the delay in the mandate. One of the other changes is, you know, this year the law said they should offer to 95% of their employee base. When that was delayed, next year it looks like about 70% will be what will be the mandate. So, you know, they'll need to continue to watch as things evolve and make sure they're consulting with their tax consultants or their brokers to make sure they're complying appropriately.
And getting information, you know, you talked about the Anthem website. You know, how important is it to have a tool like that?
It is very important. Our website, anthem.com, we have different links where you can learn about healthcare reform, and our site is smart. So if you want to take a look based on the size of your company, we can go through and tell you what you need to know about the law.
Great, anthem.com. Thank you so much, Lori,
Thank you.
for helping us out today and helping to explain some of the changes that we're seeing this year and
Thank you.
coming up next year. Really appreciate it. Now, this concludes Business Connection. I'm your host, Cathy Petersen. Thank you so much for joining us, and now stay tuned for an important message from the Dayton Area Chamber of Commerce.
Today's program is a continuation of the Chamber's efforts to make sure employers and their employees know the changes occurring in healthcare, especially in light of the Affordable Care Act. Options for healthcare continue to evolve. What had been a benefit that employers controlled is now more consumer-driven. Costs to employers have more than just shifted to employees and their families. Usage is now much more individually focused. For many employers, their healthcare plans are still unchanged, a process referred to as grandmothering or continuation of existing coverages. But for some, the community-rated programs and the individual marketplace are the plans that are seeing a change. Our Chamber's Chamber Care portfolio of products now includes our traditional grandmothered plan, individual coverage, exchanges, and self-insured pools. We continue to investigate other employer options as we view this benefit to be a key recruitment and/or retention tool in maintaining a competitive, productive, and efficient workforce. We appreciate our presenters' knowledge of this subject and also strongly advise our viewers to consult with industry professionals, including informed agents and brokers, accountants, or legal professionals who will help you make logical and beneficial decisions concerning your own health care plan or for your employer.